Hi, I'm Dr. Sindura, consultant obstetrician gynecologist and a laparoscopic surgeon at Arete Hospitals, Gachibowli. Today, I'm here to create awareness about abnormal uterine bleeding, which is a rarely spoken topic among the women in their reproductive age group. What is this abnormal uterine bleeding? Abnormal uterine bleeding is any irregular, unexpected and atypical bleeding from the uterine cavity. So, before understanding the abnormal uterine bleeding, our women need to understand what is normal uterine bleeding for them to know what abnormal uterine bleeding is. Because as women, we try to accept everything thinking that is normal. No, but we should know what normal is. A normal menstruation is that which happens for about a menstrual cycle is calculated. The first day of the bleeding is called as the first day of menstrual cycle. Bleeding happens for about 5 to 7 days and the duration of the cycle usually ranges between 28 to 32 days. So, ideally a normal menstrual cycle is which ranges between 21 to 35 days. So, in case there is any deviation from this, supposing you're getting frequent periods that is less than 21 days, or supposing you're getting prolonged periods that is more than 7 days, is when you consider it to be abnormal. And how much amount of bleeding is normal? Ideally, there's about in a period which is about 5 to 7 days for any woman, they'll have a bleeding about 80 ml. So, this menstrual blood will never clot. Supposing you are passing clots in your bleeding, that means your bleeding is more than what your body can accept. So, this is also considered as an abnormal uterine bleeding. So, what are the main causes and why this needs to be treated? Because this abnormal uterine bleeding is going to impair a woman carrying out her day-to-day activities and is going to cause a lot of bleeding that might result in drop in hemoglobin, resulting in iron deficiency anemia, which is again going to impair a quality of life. So, what are the main causes? The main causes, it could be because of any structural pathology in the uterus or could be a non-structural pathology. Structural pathologies meaning, supposing there's a polyp, is a polyp inside the uterine cavity which is an outgrowth from the endometrial cavity. So, this is going to result in heavy menstrual bleeding. Until this polyp is removed, your bleeding is never going to come under control. The next cause is adenomyosis. Adenomyosis is where the inner layer or the endometrial lining grows into the musculature of the uterus, thus causing a lot of pain for the woman and a lot of heavy menstrual bleeding during the periods. Once the woman starts bleeding, she will never stop bleeding. That is because of the condition called adenomyosis. A lot of medical and surgical managements which always better to meet your gynecologist and take treatment for. The third and the most commonest cause is fibroids. Fibroids are the benign growth from the uterine walls which result in heavy menstrual or the abnormal uterine bleeding. Sometimes just increase in the endometrial thickness or associated cancers or the endometrial hyperplasias result in this abnormal uterine bleeding. Hence, it's always better to get yourself screened for these. The other non-structural causes could be any coagulation issues or inborn disorders of coagulation, in case there are any, might result in this heavy periods, which has to be evaluated by a gynecologist so that you get the right treatment. Most of the times in the perimenopausal age groups, it could be because of the ovulatory imbalance between your estrogen and progesterones, which are the hormones of your routine menstrual cycle. The other causes could vary from precancerous or the cancerous conditions and associated malignancies, infections, pelvic inflammatory disease. There are various causes that might result in you having an abnormal uterine bleeding. So, how do you diagnose this? So, first see your gynecologist and get yourself evaluated. So, as soon as you reach your doctor's office, they're going to take a brief history, do routine blood workup to identify what is the cause for your bleeding. On the examination, you will have a pap smear that will be done for you as a process of screening for the cervical cancers, and the routine ultrasound can pick up most of the causes for you having an abnormal uterine bleeding. So, get your cause identified and get yourself treated. So what are the treatment options that you have depends upon cause of your heavy menstrual periods. Supposing it's just an ovulation imbalance, that is an imbalance between the estrogen and progesterone, just by medication it's going to be fine. Or hormone releasing intrauterine devices which have done wonders and helped many women without having any complications and regulate their bleeding. There is any structural pathology that's identified by your gynecologist, then you would definitely need a treatment for it. Supposing there's a polyp that's identified, then you would need a hysteroscopic polypectomy. Supposing there's a fibroid that is identified, depending upon the age of the woman, you'll be advised either a myomectomy, which is the removal of fibroid, or you'll be advised a hysterectomy, that is removal of the uterus. So always consider yourself that in case there's anything that's going wrong from your normalcy to be abnormal, and please seek medical advice at the right time so that you get treated well. Thank you.